Hi, we are looking at the recording of the video of an all-inside ACL reconstruction. This is a 37-year-old male patient who is undergoing arthroscopic ACL reconstruction. The anterolateral portal is the visualization portal and the anterior medial portal is the portal used for instrumentation. He had a small peripheral tear in the medial meniscus, which is being dealt by a partial meniscectomy because the tear was small and was in the peripheral zone. You can see the instrument biting it off, nibbling off the torn part. The remaining part was quite stable and was left alone. This is the lateral meniscus, and there was a small tear in the lateral meniscus as well, and the punch is being used to stabilize the lateral meniscus. As you can see, the tear was pretty small and stabilization through a partial meniscectomy was more than enough. You can actually see the punch being used to nibble off the torn part of the meniscus. This is a shaver blade which is used to stabilize the lateral meniscus and shave off the remaining part of the meniscus. Once that is done, we focus our attention on the lateral wall of the femur. We use the radiofrequency wand to shave off all the soft tissues from the wall so that we can get a clear picture of the lateral wall of the femur, because this is the most important thing we need to do before we start our tunnels. As you can see, we would like to have a complete and a clear picture. Now we shift our portal to the anterior medial side, and this is the biggest advantage of using the all inside technique. You can see the jig and you can see the location at which we want the tunnel to be placed, and as you can see, the drill bit exiting out of the lateral wall. And once the drill is confirmed at the location where we want, we use the retro reamer, and this retro reamer actually drills from inside to out. And as you can see the image, the retro reamer gives us a beautiful tunnel at the right place where we want. More importantly, the visualization is so clean and clear because we use the anterior medial portal. Here you can see the tunnel and see the guide wire passing across through the tunnel. We then go back to the anterior lateral portal and retrieve the wire from the anterior medial portal. Once the tunnels are done, we can actually visualize this tunnel even through the anterior lateral portal. And if you can see the location of the tunnel, the location comes out so perfect. It's just at the right place where we want. Even the differential pitch of the tunnel can be beautifully visualized through this. Once the tunnels are done, we then focus our attention on the tibial side, and the tibial drills are done. The tibial drill can always be done through the traditional technique, using the guide wire first and then drilling it across with the designated size of the reamer. Once the drills are done, we pass an instrument to retrieve the wire thread, and then the graft is passed across. We use an adjustable loop, and you can see the image where the threads of the graft are being pulled across the femoral tunnel. Once the threads are passed, the threads are then tightened and pulled across to pull the graft into the femoral socket. As you can see, the graft passing across, being tightened across onto the femoral socket. You can see the graft being placed at the right place across the femur, passing down all the way to the tibia. Now, as seen, the biggest advantage of using the all inside technique is that the visualization, because it happens from the anterior medial side, is much better and far more superior to the traditional technique. It also helps the surgeon because the reliance on the assistance as well as on the management of fluid, because in the traditional technique, the hyperflexion that is needed to get the tunnel right is a little cumbersome. It depends on how well your assistant is trained. It depends on how well a system you have in terms of getting the fluid pressure right and things like that. The all inside technique scores there because you don't have to hyperflex the knee, and the visualization happening from the anterior medial portal gives us a more precise exit point onto the femoral tunnel. And that's why I think all inside technique has got its advantages and scores over the traditional technique. Thank you.